Prokinetics can be like a miracle cure for digestive issues, but especially bloating and intolerance to high FODMAP and high fiber foods. But you might be asking yourself, how long do I stay on this thing? Is it a forever thing? Well, good thing I have the answer for you, my friend. Stay tuned. You might be aware already that I'm a huge fan of Prokinetics, and that's because I've been doing what I call Prokinetic speed dating with my patients and FODMAP freedom students for a number of years. So what that is that I baggie up a whole ton of herbal Prokinetics, all the ones that I'm aware of in existence at least, and I send you little tester baggies of each, and you go through week by week testing out different Prokinetics to see, does one of them help you? And if so, which one's your favorite? And when I do this, I have found that about 98% of people with IBS or SIBO or both end up finding one of these that they really, really like. But that still begs the question, once you find the one you like, how long do you stay on the thing? This is a really important question to ask with any modality you might be using, but especially with Prokinetics, because some of you might be what I jokingly refer to as lifers, meaning that you might need a Prokinetic for years and years, and some of you might just need it for like 6 months or 8 months, and then you can go about your happy merry way and have good normal motility without the aid of a Prokinetic. And knowing if you're in that lifer category or the everybody else category is really important here. But before I get into differentiating those two groups, I want to just take a moment, 20 seconds, bear with me, and just remind you what a Prokinetic does and does not do. I hear a lot of the time from people with diarrhea or IBS-D or SIBO, H2 variety, they'll say, well, I can't take a Prokinetic because my motility is already too fast, so what should I do instead? And I tell those people, nay, you would probably benefit highly from a Prokinetic, and you're getting it confused with a laxative. So if you imagine this really simple little picture that I drew for us here, in this visual representation, green is normal motility, and then up here above the green, that would be if you had motility that was a bit too quick. A lot of people would define that as diarrhea. Keep in mind that motility is a little bit more complex than what I'm depicting it here, but just bear with me for the simple version of this. And then down here below the green, this would be slow or poor motility, and we could think of this as constipation, right? So the person who might have a total gut transit time of 5 days or 6 days, they eat a corn on the cob and then they see the corn coming out the other end 5 or 6 days later versus somebody with diarrhea. So if we were looking at something like a laxative always speeds you up. It always stimulates you, in the motility sense at least. So if you have constipation, if you're somewhere down here and you take a laxative, it will move you up. And then that may result in a more normal bowel movement. However, if a person with diarrhea takes a laxative, say you start here, they are also going to be stimulated in this sense, and the laxative is going to make them have worse diarrhea. So laxatives are a big no-no for people with diarrhea for obvious reasons. However, Prokinetics work differently. They are normalizing to GI motility. They're not intrinsically stimulating. So what can happen, and I see this all the time with my data collection, is that somebody with constipation will take a Prokinetic and it moves them closer to normal and they have more frequent, easier bowel movements. Great. But then a person, another patient or another student, can take the exact same formula, and that same exact herbal formula moves them also closer to normal into the green zone where they're having less frequent, less mushy bowel movements. And again, this is the same exact herbal formula. This is the same exact Prokinetic. I've seen this happen. I remember in FODMAP Freedom, I think it was 1.5 years ago, we had 2 students in the same class who both fell in love with the same Prokinetic. One had diarrhea, one had constipation. And we would chat about it sometimes on the Q&As and kind of laugh about it and how funny it was. But keep this in mind when you're talking about Prokinetics. They could be a really useful tool for, again, like 98% of you. And I know from a recent YouTube survey that only about 30 or 40% of you have ever tried a Prokinetic, period. And a good 40-something% of you said that you're kind of waiting on it. So don't underestimate this really powerful tool. But now that I got through this piece, which I felt was really important, let's answer the question on everybody's mind. Oh my God, what category am I in? Am I in the lifer category or am I in the everybody else category? And for that, we're going to use this little depiction. So in this case, that was kind of noisy, sorry. In this case, we've got a pie chart. So this is going to be that everybody else category. And then the slice of pie that I'm going to draw in blue right now, these are the people who might be what we call lifers when it comes to prokinetics. That group of people is the people who have post-infectious IBS and anti-vinculin antibodies. So if you developed SIBO specifically because you had food poisoning, and you know this for sure, and you think that it's related, like I'm talking about the people who had food poisoning and they never felt right ever since, or they had food poisoning and shortly after they developed IBS symptoms, or people who have been diagnosed with IBS or SIBO and they've done a test like IBS Smart and it's shown that they do indeed have anti-vinculin antibodies. These are the folks who might need longer-term support with a prokinetic. Now, Dr. Pimentel, who's kind of the guy in this area of research, he and his group have said so far that they think that these people need a prokinetic. They're referring to prescription, I'm referring to herbal, but potato, potato at the end of the day. They think that these people need a prokinetic for a minimum of 5 years, which is a pretty big deal. That's why I jokingly call them the lifers. The rest of you, the people who have been diagnosed with IBS or SIBO because of other reasons, say they took an antibiotic, say you took a PPI and it wiped out your stomach acid and then you developed SIBO after that, say that there was a stressful situation or a trauma and that caused the SIBO, say that you have hypothyroidism and you think it's related to your hypothyroidism. All of these other reasons, all of these smaller pieces of the pie that make up this pink section, those are the people that I find usually need a prokinetic for maybe like 6 to 8 months. Then they could discontinue it or they could wean off of it, and then they're happy schmappy. They still have great motility despite being off the prokinetic. But I want to say something about the lifers, A, because I think that it's important, but B, I don't want to depress you too much if you are in that category. Keep in mind, and I say this with all the respect in the world for Dr. Pimentel and his group, they don't do integrated medicine. Right? They nuke the SIBO with rifaximin. They maybe put you on a prescription prokinetic. They'll tell you to reduce fermentable carbohydrates in your diet, and then that's kind of it. And that's a lot, and that's wonderful, and he serves the SIBO community so well. But that's quite a bit different than what people in my profession might do for you. So we're going to look and see, do you have any nutritional deficiencies? How's your relationship with food? Does it suck or is it pretty good? Are you exercising? Are you sleeping well? Are you super duper stressed? Do you have good relationships or poor ones that are taking away from your health? Are your hormones okay or are they wonky? Do you have hypothyroidism? Do you have a thiamine deficiency? Do you have an iron deficiency? These are the sorts of things that you can dig deeper into with a functional medicine or a naturopathic medicine practitioner or some registered dietitians like Amy Hollenkamp. But you're not necessarily going to get that total body care, even if you go to somebody like Dr. Pimentel, who's quite famous and quite knowledgeable. So I take this with a little grain of salt, or I would say put a little asterisk next to this. Theoretically, folks in that category might be lifers. But if you really take the time and put in the effort to address your root causes, like truly address your root causes, including the ones you don't want to tackle, like sleep and stress and relationships, if you do that and you have a total body approach to healing your SIBO, you might just find that you only need a prokinetic for a year or two. And I say this because I've seen it with my own eyes. I have worked with people who have very clear post-infectious IBS and they benefit from a prokinetic. And then a year or two after we start working together, they are able to successfully wean off the prokinetic. But it's because we had a total body view of healing their body. We didn't just narrow in on the SIBO and hyper-focus on that and have blinders on. We did all the other things too. So that's what I would say of the lifers. Again, everybody else, I think, prokinetic, maybe 6 to 8 months. Or another way that I've approached this pink group of people is wait until your gut feels really, really good, and then wait an additional 1 to 2 months after that, and then start to wean off of the prokinetic and the HCl or the enzymes or whatever else you're using. But that way you can really let your body heal. You can give it time to kind of soak in all that goodness and all of that healing, and then you could try to take away the crutch. It's kind of like, for lack of a better way to explain this, if you broke your leg and your legs stopped hurting on a Tuesday, you would not throw the crutches away on Wednesday, right? I hope. You would go, ooh, my leg feels a lot better. Let me see if I could go down to partial use of the crutches. Maybe I could do a little bit more physical therapy. Maybe I could do some mobilizations. Maybe I could start dropping the number of hours of the day that I have to use crutches, and then you gradually wean off. Or perhaps you give yourself a little bit more time after that ankle or that leg is pain-free, then you start this process of weaning off the crutches. But you wouldn't just drop the crutches the very day that your leg is no longer painful. That's kind of how I would approach it here too. Wait until your gut feels really good and really happy and you can digest all the FODMAPs and all the foods you want. Then, after another month or two, start to take away some of the things that helped you heal and see how you do without them. And honestly, the same kind of process applies for the so-called lifers as well. You just do that a little bit later than somebody in this pink category would. Again, pink category, probably 6-8 months you could start thinking about that, plus or minus a little bit depending on your case. These folks, it's usually going to be like a year or two that they've worked on everything to that point that they can then drop the Prokinetic. Of course, there's still the question of which one of these is going to be right for you, and luckily I can help you with that. Like I said in the beginning of this video, I do Prokinetic speed dating with all of my FODMAP Freedom students, and FODMAP Freedom is opening for enrollment so soon, you guys. If you're on the wait list, the enrollment period opens up on August 14th. And if you are not on the wait list and you're just going to wait for me to post the link here on YouTube and cross your fingers that we still have slots open, then it's 1 week later, it's August 21st. But if you have any interest whatsoever in learning more about FODMAP Freedom and exploring this as an option, I would encourage you to get on the wait list now. There's no obligation. You're not signing anything. You're just saying, hey, I want more information and I want to get my information about this program sooner than everybody else so that I can put dibs and I can get my spot before all the spots are filled up. That's all the wait list means. So if you want to do Prokinetic speed dating and find the right Prokinetic for you and then have more coaching on everything GI related, everything from nutrition to herbs and supplements to lifestyle and stress and sleep, then FODMAP Freedom is waiting for you. Join the wait list and I will see you in August. Hey guys, if you like this video, be sure to subscribe, ring the bell, click the like button, and leave a comment down below with the videos that you would like to see me do next. Doing all of those really helps support the channel and support my efforts in making as many videos as possible for you guys. Thanks so much, and I'll see you in the next video.